Yeast infection or candidiasis is a common vaginal infection that affects 3 out of 4 women at some point in their lives. The infection is so common that women can get it more than once in their lifetime. Suffering from a genital infection can be very uncomfortable and sometimes embarrassing. To reduce a woman's susceptibility to vaginal infections, it is important to know the factors increasing the risk of yeast infection in women. Yeast infection is a treatable condition, but it has the tendency to recur, and so a woman must understand what triggers candidiasis in order to stop it from developing. Yeast infection is mainly caused by the overgrowth of the fungus Candida albicans. Candida is naturally present in the vagina but normally do not cause any problem if kept in check. Good bacteria keeps the Candida fungus under control. If the natural balance of microorganisms in the vagina is disturbed, infection is more likely to occur. The natural balance of vaginal bacteria can be disturbed by many factors. These factors increase the risk of yeast infection in women. So what are these factors? Pregnancy. Women are more prone to thrush or candidiasis when they are pregnant. The changes in the vagina's environment due to increased level of estrogen and the production of more glycogen, a form of sugar, during pregnancy makes it favorable for the yeast fungus to flourish, thus increasing the risk of yeast infection in women who are pregnant. Although having candidiasis won't harm the unborn child, self-medication could endanger your pregnancy. Pregnant women should not take anti-thrush medications on their own. It is best to consult your doctor than buying over-the-counter medicines. Taking antibiotics. The use of antibiotics are usually prescribed by doctors to kill the bacteria causing infections. Taking antibiotics increases the risk of yeast infection in women. Why? Because antibiotics attacks not only the bad bacteria but also the good bacteria that fights the overgrowth of yeast fungus. When the bacterial balance of the vagina is disturbed and yeast fungus overgrowth occurs, yeast infection is more likely to happen. If you are experiencing candidiasis while taking antibiotics, talk to your doctor. There must be alternative medicines to address your health issues without causing yeast infection. Weakened immune system. Impaired immune system can increase the risk of yeast infection in women. When one's immune system is weak, it is hard to fight diseases and infections. A person is more prone to infections if the immune system is not strong enough to fight the bacteria or viruses causing the infection. Lack of sleep, malnutrition and stress are some of the factors affecting one's immune system. To reduce the risk of yeast infection in women, they need to live a healthy lifestyle to boost their immune system. People whose immunity is compromised, like those who have HIV, diabetes and cancer treatment, are also more prone to candidiasis. Sexual activities. Although candidiasis is not a sexually transmitted disease, one's sexual activity can increase the risk of yeast infection in women. The vagina is a sensitive part of the body and it is susceptible to any kind of vaginal infection and irritation during sexual activities, so it is better to practice safe sex. Practice proper vaginal hygiene, especially after sex. Too much sugar in your diet. Yeast feeds on sugar, so the more sugar you take, the more food you provide for the yeast to grow faster. If your diet is usually high in sugar, you are giving yeast a happy feast. Most people would think that a high sugar diet is only from sweets like cakes and chocolates, but a diet high in carbohydrates is also a culprit, since carbohydrates are converted to sugar once broken down by the body. Fruit sugar, called fructose, can also boost your blood sugar level. Any diet that can increase one's blood sugar increases the risk of yeast infection in women. Scented feminine hygiene products. Yeast infection occurs when the natural pH of the vagina is disturbed, and one factor that can disturb the natural environment of the vagina is by using scented feminine hygiene products like scented sanitary pads, toilet paper, vaginal deodorant or sprays and soaps. Even the laundry soap and fabric conditioners you use to wash your underwear can contribute to the changes in your vaginal environment, leading to infections. Underwear fabrics. Yeast loves airless, warm and moist environment, and if you are wearing underwear that promote sweating like those made from synthetic materials, you are giving yeast a favorable breeding environment. Constricting clothing like tight-fitting pants can also cause sweating, so wear loose pants or skirts to allow air circulation around the vagina. Create a breathable environment for your vagina to stop yeast from growing. Knowing the factors increasing the risk of yeast infection in women can help every woman prevent the occurrence of candidiasis. New ebook reveals unique holistic strategies to cure candida. Discover how to quickly and easily cure yeast infection permanently. Even if everything else you tried had failed. Without drugs, without over-the-counters, and without nasty side effects, guaranteed. Click the link below in description.